to address is, have we ever worked with Kaiser before? And another question is just clinical applications that you've implemented and seen. And of course, telestroke obviously is our leading clinical application. So if you wouldn't mind talking about the device, and I'll be here to support you in whatever way.
Okay, well, good morning, everyone. I first would like to just talk about the device and kind of give you some groundwork for that, and then we can talk about our Kaiser experience in the past. Right now, as you see me move the head around the room, you're seeing me operate this remotely from Chicago. So I have the ability to look around the room, zoom into different folks. I'm going to go ahead and take a picture of, I think someone taking a picture of me or writing an email.
I was taking
Not sure. I caught you red-handed. So as you can see, I can say, he was taking a picture of me, and I can illustrate and be really interactive with the whole group. So what you see, I have two cameras above me here. One camera is a fisheye lens, and so this little picture of yourselves, you're going to see that view. So there's Matt's hand, so it gives me a good peripheral of who's in the room, or in a setting just like this for a conference, I have a nice visual of everybody. Or if I want to zoom in nice and close, and I'm going to go ahead and pick on our physician here, and I can really get close to him, and I can, and also a good picture, but I wasn't quick enough. So anyways, you can see that I can get nice and close. So the closer I am to the patient's bedside, you can go ahead and look at pupil, capillary refill. You can see a lot of detail with that camera. So it's really, really nice for the physicians to have that flexibility as they're looking around the room. I also have a boom mic that's on top of the device, allowing me to have a really nice audio experience when I'm in the emergency department. It filters out a lot of ambient noise. And also, if it's really terrible, I actually have a little telephone on the side of the unit that allows me to have a more private conversation that takes all ambient noise out. So, Matt, I'll show you that. And then I have binaural ears on each side of the camera that will allow me to have an immersive mode, which I'm using now just to make sure I can hear everybody if you have a question, so I can hear everyone around the room. So that's kind of the unit there. You see that below me I have two speakers, like a conference call right now, being loud to everyone. I have the volume control there for the nurse, so she can make us HIPAA compliant. And right now there's a mute for both audio and the video. Video would be used for privacy issues, letting patients speak, change privately, or sometimes if the doctor could just move their head to the wall, so you don't have to mute the video. But it's an option, and then and just making sure that all patient information is kept private. If they're dealing with something different, there's a mute button there for the nurse. So just basic information, really pretty easy for all the nurses. This unit remains on 24/7. So you kind of heard that chime sound when I came on, beamed into the unit. That is our Beam Me Up Scotty sound. It actually is the Star Trek sound. And it's really allowing everybody to know that somebody is beaming into it, so we're not being sneaky on you. So none of the nurses feel like the doctor's coming in secretly and spying on them. So that's really nice.
Jill, could we talk about the sides as well?
Yeah, I was going to move that.
Sorry.
Perfect. So on the side, Matt, if you could just move it so that we're facing the little telephone.
Oh, yeah.
So, thank you. So the telephone, go ahead, Matt, pick that up for me. The telephone, you see, just because you picked up the telephone, it didn't activate it. But if you could hand that telephone to somebody, Matt. So you can see we were going to pick on someone in the room, but you couldn't pick anybody. But anyways, we had a private conversation, and that can be done with your nurse assisting staff on maybe questions that maybe they might have with the physician, and it can be private. It can be private for the nurse, so that she can feel comfortable relaying any information privately from the patient's ears. So really nice in that way. There's also some USB ports and other. There's a video in and out. Those ports allow you to connect peripherals. This device itself is FDA cleared, has a Class 2 clearance. So anything that you plug in, your ultrasound, your echoes, you name it, anything that has a video out can be plugged through this device, and you can see that image transmitted from your patient and know that you're receiving accurate information. So,
yes.
Really,
as far as the phone connection, that doesn't require dialing. It's part of your internet connection.
Yeah,
correct.
Okay.
It's part of this connection. Yeah.
She just clicked a button on our user interface on her side and turned it on.
And my second question is the session recorded, or can it be recorded?
It can be recorded. It is activated by the physician. Some of our sites prefer that the recording feature is removed, but some facilities prefer to record, and so they make that a part of their practice. It's really up to you as an organization to make the decision on that, and so we can help you decide on how you want to do it. These are condensed AVI files, so you would have to find a HIPAA-compliant way of naming each file if you did decide to record. Does that answer your question?
It did, thank you.
Okay, so there also at this side there's a power gauge and a power button. This unit has a couple power buttons. It has a base power and there's a power for the head, but it does remain on 24/7. So part of the in-servicing, which takes about 15 minutes, we just train the nurses in the event that the unit was until we use this battery charge, and we train them how to plug it back in, press the power buttons, and then it would be ready to be used again. This has a 4 to 5 hour battery life, so it has a nice long life, and you can use it for rounding. Most of our sessions are anywhere between 15 and 30 minutes, 30 minutes for rounding, but it has a nice battery life. Once it gets to 20% battery life, this robot will tell everyone in the room to please plug me in about 100 times, and then it will die. And then we'll call you, and then we'll ask you to plug it in. So we don't leave you alone until someone plugs it in. So it's always reporting to our servers, and we know that it's ready to use for you. That's part of our offering to make sure that your system's up and running and ready for those emergent patients that come in for stroke. In the future, if you wanted to do trauma, STEMI, other services that needed immediate coverage from your specialist, they could also use this to provide that coverage. On the other side of the RP light, if I get Matt to move us. All right. On the other side, we have a stethoscope. The stethoscope kit is also FDA cleared. You see there's a set of headphones the nurse would go ahead and place on their ears. And then they have the stethoscope head itself, so they can hear exactly where they're placing it, making sure that there's strong heart, lung, and bowel sounds. There's also a volume for the nurse, and there's a switch that goes between diaphragm and valve, allowing the nurses to confer with the physician what they want to listen to. Now, most of our neurologists do not care if the heart is beating, but we do know that other services do use this quite a bit, especially hospice, pulmonologists, cardiologists.
Not exactly true. We like it to be beating because it is important because the role of the heart is to pump blood to the brain. Other than that, we don't care.
Of course, yeah, I agree. So,
You're in trouble, Jeff.
I know. Can't take me anywhere. So, so basically, that's an overview of the system here. And is there any questions on any of the hardware on the RP Lite?
Oh.
Yeah.
Can you show us the user interface you're using to drive the robot?
We're gonna do that. So what we're gonna do is when Jill disconnects, Ilya's gonna take this unit to the emergency department, and we're gonna run
Show you
a mock.
the neurologist in.
Somebody's going to have
Yeah.
a stroke, I heard.
Yeah.
Good, thanks.
So really quick, I can show you just a little, I just took a little snapshot. This is what it looks like on a small scale. I see you here, and I see my own face here, and there's other little things attached to it. Just to let you know, this takes about 45 minutes for physicians to learn to become competent. They use it and practice with it for 30 minutes by themselves. It's very user-friendly. I'm moving my head by literally clicking on people's faces with my mouse, my arrow here, and I'm able to see things very easily. So it's nice and simple.
One thing I did want to add real quick, Jill, is also right here, most hospitals put a little tray here, and there's a power outlet on this. So you can put a laptop on it and plug it in, and it can be dual purpose, so that it could replace a computer on wheels. And so, yeah, the nurses can chart while the physician's connected in and providing the consult.
That's right.
Oh yeah, I can lift Jill up and down here, so.
This is more accurate. I'm really tall, so I feel comfortable
She
being
is.
that tall. No, just kidding.
When we're in a room together, it looks odd, because she's
So kind of to move to our Kaiser experience. So we have worked with Kaiser in the past, and our application was neonatology and for pediatric services. And basically the trial period was successful. They were able to see that they could view the babies and keep them in the NICU, but it just didn't have enough. We didn't have a champion to kind of push that through and get protocols up and going. And so that's kind of the downfall of that program. It did work within the Kaiser IT and facility. It's just a matter of having a champion. So I would definitely encourage you to make sure that you have a strong champion for the stroke program as you're developing that for telemedicine, and that person's able to work along with administration and different coordinators to make that a successful program. Through all the account management that we've dealt with, that's really the sign of a strong program and a successful program has all those people in place and able to work as a group to make the program successful. So we can talk about that more if that's something you want to know about, but we have an implementation checklist that really walks the whole group, the champion from the physician side, the nursing side, administration, and just making sure everybody's on the same level and moving towards the same goals for your program. Is there any questions about the Kaiser experience?
Yeah, where was the NICU project piloted?
Gosh, it was like 4 years ago. I could look it up.
It was
It's-
Central Valley, wasn't
it's
it?
There
a-
was something
It was.
with CCS
It's the same thing.
Services Central Valley.
It's
I
Santa
recall.
Teresa's, they said
Modesto,
Scott
wasn't it?
May was the IT person
Right.
who worked with him.
Wasn't it was like to Modesto or something from Santa Clara or something like that?
No, I don't think.
Santa Clara was where the physicians were,
I think it was
and we trained all the neonatologists, and we actually had
Oh, they
rather
connected
new
them.
Kaiser, and I don't.
I think it was Modesto.
Was it Modesto? It might have been. It was quite a while ago. I'm sorry. I could pull up that information.
Yeah.
Yeah, and I can send like a summary of the info that they send about
Yeah.
that.
So other applications,
contacts.
what have people used it for? You said ICU, so I guess you could have somebody that covers from the ICU, but you'd have to have the device there, obviously. And then what else have people
Yeah.
used it for?
So ICU for triage in the emergency department. A lot of our facilities are kind of doing a bundled program for emergency rooms that they're covering. I'm sorry. Did you lose me there?
Oh no, it's good.
Okay, so they basically would have a bundle would be, for example, an ESP program that would encompass, STEMI, sepsis, stroke, and any neuro coverage. So that basically allows, all the specialists to be on call and ready to use the system, and they're trained on it for those emergent patients. Within the hospitals, I can't really think of an area we don't have an application. Pharmacy for telepharmacy, for 24 coverage facilities that don't have the 24/7 pharmacist on site, hospitalist coverage, night rounding, cardiology, neonatology, perinatology, movement disorders, swallow eval, mother-child ambassador programs where maybe a mother might